Good day to the viewing and listening audience, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week beginning October 19th. My name is Richard Mota Jr. I am the Communications Director for the Office of the Governor, standing in for Governor Bryan, who is caught up at a prior engagement. I want to begin today on behalf of the Governor with a brief tribute to the life and legacy of an outstanding Virgin Islander. It is with great sadness, the Governor said, that Yolanda and I learned of the passing of Mr. Austin Babe Monsanto this weekend. As a veteran, educator, long-serving Marine Manager of the Virgin Islands Port Authority, and lifelong Rotarian, you would find great difficulty in any attempt to quantify his contributions and impact to our community. I have fond memories of Mr. Monsanto when he served at the Port Authority. His name was a staple in my home, and I came to admire and respect him as a trailblazer. My mother always spoke highly of him and his commitment to excellence. Yolanda and I extend our deepest condolences to his family and friends, especially to his wife, Alda Scholterbrand Monsanto, and his children, Trevor, Stephen, and Edwin, as well as all in the Virgin Islands community who mourn his passing. I have with me today the Commissioner of the Department of Health, Commissioner Justa Tita Encarnacion, and she will provide the COVID-19 statistics and the PUI update this afternoon. Commissioner Encarnacion.
Thank you, Director, and of course my condolences also to the Monsanto family. Good afternoon, everyone. As of October 19, 2020, the Department of Health has tested a total of 22,879 persons under investigation, or PUIs, of which 1,335 have tested positive and 21,517 have tested negative. There are currently 18 active cases in the territory. 1,296 cases have recovered, with 21 fatalities related to COVID-19. From our hospitals, Wang Lui Hospital and Medical Center reports 0 COVID-19 cases, and Schneider Regional Medical Center reports 3 positive COVID-19 patients, and one of those patients is vented. JFL has remained COVID-19 admission-free for 4 weeks straight. Wonderful news. RLS remains with low COVID-19 admission rates with varying acuity levels. We continue to test our community members using our department's public health laboratory, our hospitals, private providers, labs, Frederiksted Healthcare, our FQHC on St. Croix for COVID-19. Department of Health captures the data and reports to you daily with the exception of Sunday. Our epidemiology hotline is still open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases of COVID-19. That number again will be repeated at the end of my statement. Testing is important, but guess what's coming next? Most importantly, continue to frequently wash your hands with soap and water for 20 seconds or use hand sanitizers. Practice good respiratory hygiene like coughing into your elbow. Practice physical distancing and find creative ways to remain social with friends and families using virtual means where possible. And, of course, maintain the proper use of masks. Those simple steps can and have proven to keep us all safe. We recently released a travel advisory. As the COVID-19 pandemic changes, we continue to adjust to those changes and implement local mitigating efforts to reduce the risk of our community. Hence, as Commissioner of Health, I am advising against non-essential travel due to COVID-19 increases cases in the United States mainland. As we all know, travel increases your chances of getting COVID-19. Staying home is still the best way to protect yourself and others. While you're strongly discouraged from non-essential travel at this moment, I note that there are some individuals who must travel for essential reasons. If you must travel and you do not get tested at your destination, you will be referred to a local lab for testing 3 to 5 days after return and are required to quarantine until you receive the test results. If you must travel, please use the guidelines you are so familiar with. We live in such a beautiful place in the United States Virgin Islands. It is a popular travel destination, especially as it gets cold in all parts of the world. It's important to remember that all travelers to the U.S. Virgin Islands age 5 and older must produce either a negative COVID-19 antigen, molecular PCR rapid test result from the test taken within 5 days prior to travel or a positive COVID-19 antibody test result taken within 4 months prior to travel to the USVI. Every traveler age 5 and older must use the travel portal at https://usvi-travelportal.com before travel. This goes for residents and visitors alike. Children 4 years of age or younger are exempt from this testing requirement. For those of you that travel and those who have family and friends traveling to meet you, please remind them of the importance to be tested before they come. Our energy level is still way up there, and we are still boots on the ground. Our team will be back on the ground this week in both districts. Look out for us and listen out for us and our sound trucks as we visit various parts of the island playing COVID-19 prevention messages and our catchy jingles. We continue to educate our community, provide you with the tools you need to protect yourselves, and ultimately slow the spread of COVID-19 in the territory. In the past week, we safely distributed 10,500 masks, 2,170 educational flyers on COVID-19 and hurricane preparedness to the community, and 500 hand sanitizers. We will continue to do our part, so we just need you to help us. Something new. We recently published our influenza vaccine schedule for both districts, and it can be found on our website, doh.vi.gov, and our Facebook page. I am encouraging you to take advantage of the opportunity to get a free flu shot. It is still very much a healthy priority, especially for those who are vulnerable, like the elderly and young children. Pregnant women are also encouraged because it keeps you healthy and it keeps you safe. The flu vaccine will help to prevent the seasonal flu and keep you healthy. Being healthy means being stronger and would allow you to fight against other infectious diseases like COVID-19. Yes, you were right. That was coming. Please take advantage. The flu vaccine is encouraged for children 6 months of age and older. Finally, but very important, it's critical that if you know you've been exposed to the virus or suspect that you've been exposed, you must quarantine and stay at home and away from others while awaiting for your results. You must be responsible as an individual. We all need to do our part to continue to keep our community healthy. If you are experiencing fevers, chills, muscle aches, or a cough, or have any symptoms at all, please call the Department of Health's Epidemiology Division at 340-712-6299, 340-712-6299, or 340-776-1519, 340-776-1519. If you are sick, please stay home. If you get tested, please remember you are required to stay at home and quarantine until you receive a result or are cleared to be discharged from quarantine by the Department of Health. To keep you with our daily reports, except Sunday, as I said, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com, or COVID-19 Health Information Alerts. Text COVID-19 USVI to 888-777. Again, text COVID-19 Health Information. Text the alert to COVID-19 USVI to 888-777. And as I always end by saying, we have to do it. We'll do it together. This too shall pass. And I wish, of course, blessings to each and every one of you. Thank you. Thank you, Director.
Thank you, Commissioner Encarnacion. I will proceed with our customary update on the unemployment insurance numbers. As of this morning, the Virgin Islands Department of Labor has issued 42,489 unemployment insurance checks totaling just over $32.7 million to Virgin Islands residents impacted by COVID-19 related job losses. The department has also issued an additional 27,780 federal pandemic unemployment compensation payments totaling just over $42.6 million. The Department of Labor has issued 3,264 pandemic unemployment assistance checks totaling $5.6 million. and has issued $1.7 million in pandemic emergency unemployment compensation payments. That means to date, the Bryan Roach administration has issued a total of 74,402 unemployment benefit payments to Virgin Islands residents, totaling $82.8 million. With respect to the stimulus, just as a reminder, for those of you who have not yet filed your 2018 income tax or Form 1040 for your CARES Act stimulus payment, the deadline to turn in those filings to the Bureau of Internal Revenue is November 21st. It was originally scheduled to be October 15th, but the Bureau of Internal Revenue had extended that, so the new date is November 21st, 2020. The Bureau will continue to make payments, stimulus payments, until December 31st, 2020. So I'll repeat that. The deadline to turn in your filings to be eligible for a CARES Act stimulus is Saturday, November 21st, 2020, and the Bureau will continue processing those stimulus payments to eligible Virgin Islands residents until December 31st, 2020. Taxpayers are eligible for the stimulus so long as they are not claimed as a dependent on someone else's return, they have a valid Social Security number, have no income, or have income that does not exceed the required thresholds. And you can find all of that information either on the IRS's website or the Bureau of Internal Revenue's website. Taxpayers are also reminded that they are entitled to one stimulus check. So if you have received more than one stimulus payment, please contact the Bureau of Internal Revenue to get that cleared up. In closing this afternoon, I want to remind the public of our many efforts to keep you informed on the work that we're doing on your behalf. We have our commissioners and directors on local radio talk shows throughout the week, taking your questions and discussing the initiatives within their respective agencies. And of course, we have the Press Box, which airs every Thursday on our Facebook Live and on the Government Access channel, which is channel 27, if you have VIA. Be sure to catch this week's episode featuring Department of Sports, Parks and Recreation Commissioner Calvert White as he gives an update on the many projects underway to improve sporting and recreational facilities throughout the territory. Speaking of projects and recovery, we also have a show called Recovery in Focus, which airs the last Thursday of every month on WTJX, hosted by the Office of Disaster Recovery Director, Adrian Williams-Octolin. And last but not least, we also have a new program called USVI, hosted by Health and Human Services Senior Policy Advisor to the Governor, Dr. Julia Sheen, and that show is focused on the Governor's Healthier Horizons Healthcare Initiative. That show airs every other Tuesday, on Facebook Live and Channel 27. Be sure to tune in to the next episode, which will air at 6:30 p.m. on Tuesday, October 27th. As transparency being one of the cornerstones of the Bryan Roach administration, we remain committed to keeping you informed. That concludes our press briefing and our update this afternoon. We will take any questions now from the media if there are any. And we do not have any questions from the media, so I bid you adieu until next week. Thank you for your time. Thank you for tuning in. Stay safe. Have a good afternoon.